Late-stage vaccine trials are already heating up, but it comes as we're hearing troubling new reports about lingering effects of COVID-19. I spoke earlier with Dr. Imran Ali. Good morning, Dr. Ali. Many patients say they're suffering from COVID symptoms months after being diagnosed. The CDC now says 35% of people who've tested positive were still not back to normal after the typical recovery period. What are you hearing about this?
Well, Alex, I've been treating patients from age 20 up to 90, and I am seeing what we call a post-COVID syndrome. In fact, the National Institutes of Health has identified that most people who survive a virus, but particularly coronavirus, have this long-standing fatigue and malaise. They're even calling it myalgia with encephalomyelitis, which is a chronic inflammatory syndrome that we really don't understand quite yet. But we're seeing a lot of people, even months after surviving the virus, having long-standing effects, including memory and fatigue.
Also, Moderna has started their phase 3 vaccine trial in the U.S. Pfizer is also beginning late-stage trials. How long does it normally take to know if a potential vaccine is effective, and how quickly could it come to market?
It's been a breakthrough. Yesterday at about 6:45 a.m., the first volunteer had the injection, a test vaccine injection. And now with this phase 3 trial, it's going to take quite some time because this is going to be 2 doses, 28 days apart of the test vaccine. And then to really see if it's effective, we're going to have to collect a lot of data, and it could take several months. Some estimates say that we could see something by next spring. We will first see the vaccine deployed to healthcare workers and those who are more vulnerable before to the general public.
Doctor, on Monday, the teachers union in Florida called the rising number of children infected with COVID in that state, quote, alarming. What do we know about why so many more children are getting infected?
Well, we do know that from a study in South Korea, at least, and some studies in Europe, that children under the age of 10 are less likely to be spreaders because they just don't have the capability to replicate the virus so rapidly as those above age 10 years old. That being said, we are still seeing now in Australia where schools have been shut down because there is an uptick in cases with young children, spreading it to other young children.
Well, and you heard the doctor say a vaccine by next spring, and already we've seen some companies pivot and say that they're going to have folks work from home until spring of next year as well.
Definitely.